This question was that people receive health care whether they have insurance or not. So where do both sides, I guess I'll let you go first, where do you stand on so do people have a right to emergency room care, and if not, what do you do with them?
Okay, so I guess we'll go ahead and answer that question
Yeah,
first.
I mean, it's kind of the follow-up there.
Yeah.
Implicitly, it means you have a right to care if you get that.
The word right is something, I mean, if we're going to talk about it like specifically, like it's thrown out, very casually, but it has a very specific meaning. If you want to like talk syntax, if you want to talk brass tacks. As far as the emergency room goes, I think that's more of a pragmatic kind of thing. The fact that with healthcare, if somebody is bleeding in front of you, you don't have the time to say, do you have insurance? And think about the liability for hospitals if they're just letting people die because, say, they don't have the papers on them. I don't think that's necessarily speaking to an innate right more so as it is utility. For example, if a private business owner has a restaurant and somebody comes crawling in starving, they're not going to say, let me see your Visa card. They're probably just going to give them food first. I think that is kind of, like I said, more of a utilitarian practice than some implicit way of the government inferring that we all have a natural right to hospital bed.
Those are laws. If you're stating that people don't have a right to emergency room care, the point that Yamil here was trying to make before was they're explicitly bleeding in front of you. He was talking about the cancer patients. What if they're bleeding internal? How do you know these things? But they get denied because they're not cut open. You said that, what are we trying to reform? We want to make it so that when people get sick, they can get help. And it's that simple. And so many people get sick and can't get help because they're not bleeding out. They're not in the emergency room, but they're dying. So that's what we're trying to do.
Okay.
Make it so that everybody can get help.
We want that too. And I mean, if you want to address the people who are sick, we need to tell me who is sick and can't get help. I mean, let's talk specifics.
47 million Americans.
That's the number of people.
Yes.
That is the number of people that don't have health insurance. You're talking about people who are sick and cannot get help, who are sick and because of lack of insurance. We're talking about that's 20,000 people, okay, per year. The latest.
Republicans offer some sort of lame excuse like tort reform that is supposed to suddenly solve all of our problems when we're now the only developed democratic nation on the face of the planet not without socialism, without a decent healthcare system.
Also the richest.
Okay, to answer the actual question, we hear this a lot, the Republicans of the party of no, we don't have any plans, and yada, yada, yada. We hear this all the time from Nancy Pelosi when she has her, press conferences throughout Kansas. The fact of the matter is, I don't know exactly what you expect from the Republican Party right now. We're in the super minority, and as such, the Democrats have specific leverage in Congress. The Republicans actually have put forth 35 bills since, I believe, the first one was in March or April. Between April and June, they have all been released, and they're being stalled by the Democrats, by Nancy Pelosi. They're not allowed to go to committee. You can access them if any of you are interested on house.gop.gov. I think it is Tom Price's specific page that has them all listed. There's a PDF, and it has a link to the actual bills themselves, and it has a summary on the PDF there. So, I mean, if you guys are interested in the actual plans, they're there.
For the internet link, but what is your plan?
Excuse me, I'm speaking now. I said there's 35. They're very different. Okay,
What are
you guys. Okay,
Can you give us your plan? Give us yours. Please give us your plan.
Please leave an answer. Do you have enough time for me to go into a detailed explanation of 35 bills?
You're expecting us to do that, so I'm expecting the same thing from you.
Excuse
me.
So, yeah, exactly. Again, do you want me to explain each of the 35 bills right now?
I would like your ideas,
because
yes.
you cannot give me 5. I don't know
We've
what you
given you
expect.
Tax rebates, lowering prescription drug care costs, tort reform, selling insurance across state lines, proper regulation of insurance companies, again. So you can keep saying, all you have is tort reform. I just listed 5 or 6 things in the very plan.
They failed. Why have they been enacted?
George Bush administration.
No, they're not.
It was actually enacted in Texas in 2005, and the rate of premiums has actually risen at 4.3%, which is exactly the average rate of premiums rising versus wages in the rest of the world. So, I mean, in the rest of the United States.
Texas is the most stable.
Look at the Illinois state. I think you'll be surprised. Texas might have had something like weird in the past that might have.
If it's substantial, why didn't it reduce premiums?
It did. In Illinois, it did.
In Illinois, right? Not in Texas. And if it's a silver bullet, why doesn't it work everywhere?
You're acting like Texas is a very small state that
You're condoning it for the entire country.
Yeah.
If it won't work in Texas, which is a big state, why will it work in the entire country?
What you are proposing was enacted in Massachusetts. It did not work there. Why?
No,
It's completely different.
no, we are not condoning universal health care. We're not condoning
You
universal health
don't think you want people to have health care? What's wrong with you?
So you're saying if it's not a universal plan, that it's not healthcare?
What is your plan?
The plan is three-part. The plan is more stability and security for people who already have health
How are
insurance.
you going to how?
So you want me to go through every detail of the bill? Or
You just asked us to do this. All right, guys, they have puppies and rainbows, and it's going to be fine. What's our proposal?
If I could, I'm an instructor and I teach public policy and I've studied a lot of healthcare. And so I would like to insert a little bit of facts to either side of this. In fact, Nixon was one of the great health policy innovators in the United States in domestic policy. His domestic policy was quite innovative. One of the things he brought in was health maintenance organizations, a variety of things like that in response to the need to control cost in Medicare and Medicaid in the early 70s. So just, historical facts. So it's not, and I'm not, neither side seems to be aware of it. One other question for the Republicans. Why wouldn't a public option create competition?
Well, I've stated this a couple of times. A public option it would be, in essence, one, behemoth government companies. We all saw how well, national corporations work, like Fannie Mae and Freddie Mac. But anyways, one, that's supposed to compete with whatever, insurance companies are allowed per state. I don't know. I mean, the government can print up their own money, and the government can essentially do whatever it wants because it is the government. They say it's going to be, keeping insurance companies honest. Who's going to be keeping the government honest? That's what I'd like to know.
The people.
Okay. Do you like George W. Bush? Do you think he was an honest man? Why didn't you keep him honest?
their party is in
One more thing.
That would be Florida, Palm Beach area that would.
The fact of the matter is, if the government, you can say like, oh, we're going to march in the streets, we're going to vote them out, and that's great. Those are things that, I hope people are involved in politics, but the fact of the matter is, there's not much you can do if the government wants to do what it wants to do. So let's not be naive here. I mean, let's not give the government this power over our lives. There's ways to solve the problem that do not involve just, giving everything to the federal government.
One more thing, guess who makes the laws that govern the insurance companies and can change their policies, like the pre-existing conditions thing? So essentially, they'd be competing against someone that not only doesn't have to turn a profit and can just print money when they don't, they legislate the laws that inhibit the insurance companies from doing their jobs in the first place. What kind of fair competition is that? And I understand liberals have never been good understanding the free market and competition. This isn't new, but I mean, how is that fair? Explain to me how someone who can make their own money, is not required to turn a profit, and controls the insurance companies is a fair competition. How is that inserting competition into the market?
I'd like to respond to Andrea.
Yeah.
Okay. It is a public option. The key word is option. You know who's going to keep the public option fair? Private insurance. If you don't like the way public option is running, you can go to a private company. That's what the point is. That creates competition. If you have the public option, people can choose. I would like to go to the public option because they do things better. If they don't think they do things better, you can go to the private option. That's the point. That creates competition. Not opening up state lines. That doesn't create competition. Why should I, if I live in Miami, have to drive all the way to Georgia to get my health care? Why?
We seem to have a vast misunderstanding as to what exactly that policy is.
Wait, can I?